Have you ever wondered how often you pay attention to your legs? Older adults face problems that can seriously impair their quality of life, but they are often ignored. So let's look at the three main leg issues that should not be neglected and discuss how to avoid them. Have you ever thought about how important your knees are? They are possibly the most overloaded joints in our body. They bear the entire weight of the body, and over time, especially after the age of 60, they start to remind you with pain. If you feel discomfort when climbing stairs or on long walks, it may be the first warning sign. Perhaps you often think, well, it's just fatigue, and continue to ignore the symptoms. But imagine that with every step, your knees lose their previous mobility, and the pain only intensifies. Think about it. Do your knees hurt during prolonged exertion or walking? If yes, then it's time to understand what's wrong with them. When knee pain becomes more frequent, many begin to accept the thought that it is just a part of aging. However, if you continue to ignore the symptoms, you risk not only worsening the condition, but also entering a vicious circle where pain will limit your activity and the lack of movement will lead to even greater problems. So, what really causes joint pain? Arthritis and osteoarthritis are the two most common causes that develop over time, especially in older adults. In these conditions, the cartilage covering the joints begins to break down, leading to inflammation and pain. These conditions do not go away on their own and require careful treatment, but you can change the course of events. If caught in the early stages, you can prevent further deterioration of joint health. But how can you do that? Let us explain. The good news is that there are solutions. Stretching and strengthening exercises for the muscles around the knee joints can significantly improve their mobility and reduce pain. Don't think that exercise is only for younger people. Moderate physical activity is extremely beneficial for older adults and can be done at a comfortable pace. Simple movements, such as calf raises or knee bends while sitting, can strengthen ligaments and joints, preventing further damage. But it's important to remember that all movements should be smooth, without sudden efforts. Additionally, there are special hip stretching exercises that can help relieve pain. These workouts will not only reduce the load on the joints, but also improve blood circulation, which is important for nourishing the cartilage. Just 15 minutes a day, and your knees will thank you. As with any problem, joint treatment requires a comprehensive approach. In addition to exercises, it is important to monitor your weight. Excess weight significantly increases the load on the knees, which accelerates cartilage breakdown. Losing just 5 to 10% of your body weight can significantly reduce pain and increase mobility. Also, don't forget about using orthopedic aids. Special knee pads or braces can help reduce tension on the joints and lower the risk of inflammation. For deeper recovery, you can use supplements that help restore cartilage, such as glucosamine and chondroitin. But before using any medication, consult with a doctor. As the years pass, your body becomes more vulnerable to joint diseases. Delaying treatment can lead to more serious consequences, such as chronic pain or even the need for surgery. So, don't delay taking care of your knees. Instead of just tolerating the pain, take the first step today. Do the exercises, watch your diet, and consult specialists to find the appropriate treatment. Remember, knees are not just body parts, but crucial joints that help you move and enjoy life. Knee pain is a signal that should not be ignored. Your joints will not heal on their own, but with proper care and attention to your condition, you can significantly improve their health and regain an active life. Don't let joint pain control your life. Start taking care of yourself today so that you don't face even bigger problems tomorrow. Which knee exercises have helped you? Share your experience in the comments and tell us how you take care of your joints. Why do your legs hurt by the evening? Varicose veins may be the cause. Imagine, you've been on your feet all day. and by the evening you feel the heaviness in your legs becoming almost unbearable. Sometimes they swell, and you experience pain and burning in your veins. Does this sound familiar? It could be varicose veins, a condition that affects millions of people, especially older adults. It may seem like just a common old age condition, but in reality, it's dangerous and can lead to serious consequences if not addressed in time. And yes, despite the prevalence of this disease, most people don't realize how it impacts their health until it's too late. Do you recognize that standing all day increases the load on your veins, meaning the chance of developing varicose veins grows? Excess weight significantly increases the load on the knees, which accelerates cartilage breakdown. Losing just 5 to 10% of your body weight can significantly reduce pain and increase mobility. Also, don't forget about using orthopedic aids. Special knee pads or braces can help reduce tension on the joints and lower the risk of inflammation. For deeper recovery, you can use supplements that help restore cartilage, such as glucosamine and chondroitin. But before using any medication, consult with a doctor. As the years pass, your body becomes more vulnerable to joint diseases. Delaying treatment can lead to more serious consequences, such as chronic pain or even the need for surgery. So, don't delay taking care of your knees. Instead of just tolerating the pain, take the first step today. Do the exercises, watch your diet, and consult specialists to find the appropriate treatment. Remember, knees are not just body parts, but crucial joints that help you move and enjoy life. Knee pain is a signal that should not be ignored. Your joints will not heal on their own, but with proper care and attention to your condition, you can significantly improve their health and regain an active life. Don't let joint pain control your life. Start taking care of yourself today so that you don't face even bigger problems tomorrow. Which knee exercises have helped you? Share your experience in the comments and tell us how you take care of your joints. Why do your legs hurt by the evening? Varicose veins may be the cause. Imagine, you've been on your feet all day, and by the evening you feel the heaviness in your legs becoming almost unbearable. Sometimes they swell, and you experience pain and burning in your veins. Does this sound familiar? It could be varicose veins, a condition that affects millions of people, especially older adults. It may seem like just a common old age condition, but in reality, it's dangerous and can lead to serious consequences if not addressed in time. And yes, despite the prevalence of this disease, most people don't realize how it impacts their health until it's too late. Do you recognize that standing all day increases the load on your veins, meaning the chance of developing varicose veins grows? Compression stockings. This is one of the most effective methods for dealing with varicose veins. Compression garments help keep the veins in the right position, improving circulation and preventing blood stagnation. Medications. To strengthen the walls of blood vessels, medications containing diosmin or rutin may be prescribed. These reduce capillary permeability and help strengthen them. Laser therapy. If varicose veins are in the early stages, you may be offered laser treatment. This is a minimally invasive method where affected veins are blocked using a laser beam, leaving no trace behind. Surgical intervention. In severe cases when varicose veins have led to complications such as trophic ulcers or thrombophlebitis, surgery may be required. However, with modern technologies, this intervention has become less traumatic and involves a short recovery period. When varicose veins are left untreated, they can lead to various complications. One of the most dangerous is the formation of clots, which can travel to the lungs, heart, or brain, causing a thromboembolism. Additionally, varicose veins can lead to chronic pain, fatigue, and in the most severe cases, trophic ulcers on the skin. But most importantly, varicose veins do not disappear on their own. The longer you wait, the harder treatment will be. Therefore, it's essential to act in the early stages. Simple foot care, proper physical activity, and if necessary, medication or consultations with a doctor can significantly alleviate your symptoms and improve your quality of life. Don't let varicose veins dictate the terms of your life. It's not necessary to feel pain and heaviness in your legs every day when you know how to take care of yourself properly. Besides compression stockings and medications, simple steps can keep your legs healthy and active for many years. Elevate your legs daily. Wear proper shoes. Avoid high heels. Perform massages to improve blood circulation. Eat properly and manage your weight. What helps you feel better when your legs hurt? Share your methods in the comments, and together we'll explore new ways to maintain healthy legs. The secret to our mobility is hidden at the very bottom, in the feet. When was the last time you thought about how they feel? Yes, we all know how important the knees, hips, and back are. But your feet are the foundation on which the whole body rests, and if something's wrong with them, you can face a range of problems. They support your body weight, and incorrect foot positioning can affect your entire posture. Flat feet is a problem that many, especially older people, face. But what does it actually feel like? Have you ever felt pain in your feet after walking for a long time? Did you have problems with fatigue in your legs or headaches? This could be a result of flat feet, a condition that's often unnoticed until it's too late. But here's the good news. You can prevent and even correct flat feet with simple steps. Let's explore how to do it. Flat feet are not just a cosmetic defect. This condition occurs when the arch of the foot drops and the foot becomes flatter, which disrupts the normal biomechanics of the body. Flat feet used to be considered an age-related problem, but today it occurs in young people too. It is especially important to recognize flat feet in the early stages when it hasn't led to serious consequences. Here are a few signs to watch out for. Pain in the feet and ankles. If your feet start hurting after standing or walking for a long time, it may be a sign that the arch of your foot has dropped. Constant fatigue in the legs. When the arch of the foot stops performing its shock-absorbing function, the load on other parts of the leg increases significantly. This can lead to quick fatigue. Posture and gait problems. Flat feet can cause changes in your walk. You may start to slightly curve your legs or stand incorrectly. Swelling in the ankles. When the load is distributed incorrectly, it leads to additional strain on the legs and swelling. If you notice any of these symptoms, don't wait for the situation to worsen. You can start treatment and prevention now to avoid serious consequences. Flat feet can lead not only to pain in the feet, but also cause problems in other parts of the body. The unbalanced load on the joints and spine can lead to knee and hip pain. When the foot isn't functioning properly, the load shifts to the joints above. This can lead to premature wear of these joints. Back and lower back pain. Improper weight distribution due to flat feet can cause spinal curvature, leading to back pain. Headaches. All these changes in posture and load can affect circulation, sometimes leading to headaches. However, don't panic. You can prevent all these problems if you start taking care of your feet right now. So, if you've discovered you have flat feet or are starting to notice symptoms, what should you do? Don't worry, there are effective treatment methods that can help you restore the correct shape of your feet and prevent further problems. Orthopedic insoles. This is the first thing you should use for flat feet. They help properly distribute the load on the foot and support the arch. Insoles can significantly alleviate pain and fatigue. Proper footwear. Your feet deserve the best. Choose shoes with good cushioning and arch support. Shoes with flat soles or uncomfortable toe boxes will only worsen the situation. Foot exercises. Exercises to strengthen the muscles of the foot will help maintain the arch and prevent it from dropping. Simple exercises like rolling a ball with your feet, calf raises, or stretching your toes can work wonders. Foot massage. A light massage will help relieve muscle tension and improve blood circulation. This is especially helpful at the end of the day when your feet are tired. Corrective devices. In more advanced cases, your doctor may suggest special devices or night splints that help restore the arch of the foot. If you've started noticing severe foot pain or can't get rid of fatigue even after resting, you may need to see a doctor. Surgical intervention is only used in the most severe cases when traditional methods no longer help. Your doctor may order diagnostic tests, which may include X-rays or ultrasound of the feet. This will help accurately determine the degree of flat feet development. Examination and consultation on treatment options. The doctor will recommend the most suitable treatment based on your condition. Don't wait until the problem worsens. It's important to see a specialist as soon as possible to prevent the disease from progressing. Flat feet are not a sentence, and you don't have to live with it. There are many methods that can help you restore the health of your feet and avoid pain and fatigue in the future. The key is to start caring for your feet on time. Remember, every step you take on the path to foot health is a step toward a better quality of life. After all, it's your feet that support you throughout your life, and you must take care of them always. What foot exercises help you? Share your experience in the comments, and don't forget to monitor the condition of your feet. Think everything's fine with your feet? Check for any of these symptoms. Share in the comments if you notice anything similar, and let's discuss how to improve your condition. Your feet are the foundation of your health and mobility, and if you ignore these three problems, you risk worsening your quality of life. But most importantly, don't panic. If you start caring for your feet right now, these problems can be avoided. Take care of yourself and your feet, because they are your main allies in movement. Remember, caring for your feet is not just a precaution, but the key to a long and active life. Don't put off until tomorrow what you can do today. Share in the comments which tips you liked, and share your experience because every step toward health is important.